an individual who comes to us with a blood sugar of about 400 milligram per deciliter. He is having this blood sugar in his, whether we check it in the venous sample or in the capillary sample, his blood sugar is showing 400. It means that all these red marks are RBCs, and this presume as glucose. So this is glucose and this is RBCs, and inside the RBCs the hemoglobins are attached or glycated with this glucose. So this is what we see as HbA1c. So the individual's HbA1c at this particular point of time can be anything between 10, 12, 13 based on how long he is carrying these sugars. So as we said earlier, it is dependent on the concentration as well as on the duration. So based on that, the HbA1c can be anything between 10 to 15 or so. So after 45 days, now that the individual is being treated by you and me, so what happens after 45 days? So of the RBCs will now still carry the same amount of blood sugars with them. So or the hemoglobin will be glycated with the same amount of glucose after 45 days. So what happens to the remaining 50% of RBCs here? These RBCs gets destroyed. So there will be new RBCs. Since the individual is being treated by us, his blood sugar now at this point of time will be lesser. So the newer RBCs will be exposed to low sugars. So these are all, as we said, these are all the bigger ones are irreversible reactions. These are all the ones which are newly formed. So these newly formed RBCs will have lesser amount of glucose. So the cells will have less glycation products, less HbA1c. But as we test, the HbA1c may come down, like let us presume in the previous case the HbA1c was about 12. Now the HbA1c may come to 10, but it will not go to the ideal stage in spite of the blood sugar fasting and postprandial happening to be normal at the end of 45 days. The reaction being these RBCs has to be cleared of their sugars, but that has not happened because of the non-reversible nature of this Amadori reaction which we saw earlier. So after 90 days, what happens? The entire RBCs gets destroyed. The new RBCs are produced, and all these new RBCs, because of our treatment or lifestyle management or whatever has happened, it has got replaced with the newer blood sugar, newer sugars. So as we see after 90 days, the HbA1c will reflect the real blood sugar at that point of time. So it exactly takes, that is the reason why we need to, because the cells has to go a complete life cycle of production and destruction for us to reflect the real HbA1c. So it takes about 90 days for us to know the real HbA1c, and that is the reason why we need to wait for at least 90 days to 120 days before asking for a newer HbA1c in our patients. So this is very, very important. So don't ask a HbA1c after 45 days or so, because it just gives 50% of the data of the patient at that point of time, or probably 60%, but always wait for 90 days before asking for a newer HbA1c in our patients, the reasons which we have explained. So now we will come to the classification. So as we said, 2011 the ADA came out with including the HbA1c for diagnosis of diabetes. A level of 6.5 is more than sufficient to know a patient is whether diabetic or not. So two numbers that we need to remember are, for diagnosis it is 6.5. For monitoring, we try to aim a blood HbA1c of less than 7 in most of our patients. So that is very, very important. So why did ADA came out with this number of 6.5? That is very, very important, that we will see shortly. So the reason being, they looked into huge insurance-based data. The ADA looked into this insurance-based data, and they found out when the HbA1c was rising from above 6.5, as you see, the retinal complications which were developed, they were steeply increasing after 6.5. That is the reason like why the HbA1c level has been fixed at 6.5. The ADA and other groups, including ASD, everybody knew that if you try to keep an HbA1c even 0.1 higher than what is recommended, millions of patients will become diabetic. That was very sure. But in spite of that, they were very categorically, like it is not because of any other reasons that the level was fixed at 6.5. They were able to see the huge insurance-based data, like the retinopathy complications were increasing when the HbA1c was crossing the limit of or crossing the level of 6.5, and they have fixed it at that number. So the magic number is derived based on these data. So now we will move on to, once we have understood some of the basic concepts, like what are all the two steps that is involved. One it is it should be like concentration. The other is the duration of the blood sugar in the blood. That is very, very important. What initially passes the glycation products goes through Schiff base, which is reversible, and then it goes to the irreversible process that we have understood. And we have understood like what is the number, why the 6.5 has been fixed. So having learned these basic concepts, we will now interpret all this what we have understood to these real-time cases.